It is my first child, yes.
So you didn't have a child in the...
I didn't have a child in England. I was, throughout the first 36 weeks, all my care was with the midwife in London, and I was expecting to have her born in the birth centre in London. For personal reasons, I relocated, and actually didn't know that I wasn't going to have the option of a birth centre in Ontario until I arrived, which is why then I worked with the midwife to find a place that I felt was smaller, because that option wasn't available to me.
If it's such a good idea, why don't we have it in Ontario? Why are we still waiting for birth centres?
Well, it's an excellent question, and in reality, we've been trying to have it in Ontario for several decades. So there have been several attempts to get birth centres up and running in Ontario. There was a previous commitment on the part of the Ontario government to fund birth centres, and the funding for those birth centres, I think unwisely, was cut. Birth centres, we believe, are a cost-saving option and need to be looked at again. In this current climate, it's particularly important to ensure that people who are utilizing the hospital really need to be there. Childbirth is the number one reason for women to be admitted to hospital in Ontario, and we certainly have good international and Canadian data to show that out-of-hospital birth is safe. Lots of women want it. But not everybody wants to choose a home birth. We need to have this institutional option for women and families to have their babies in a safe, low-risk care center.
Can you quantify the cost savings? Is there any way of giving people an idea of how much it would save?
Well, I would say that we know that hospitalization is the most expensive way to provide acute care. It's perfectly appropriate for people who need to be there, but it's very costly for people who don't need to be there. So it does cost many thousands of dollars a day to have somebody in a hospital. Because there is a lot of funding already for the midwifery system in place, the midwives' funding is already provided. So that there wouldn't be any additional funding there. We need capital costs just to get the birth centers up and running. Operating costs are already written in. So we know it would be a cheaper option. We can quantify the savings in, excuse me, in terms of the reduced rates of intervention, for example. So we know that being outside of the hospital, as well as being in midwifery care, are two things that will reduce rates of cesarean section, et cetera. If we look at the cesarean section rate in Ontario being close to 30%, in midwifery care, it's 15%. It's lowest in out-of-hospital births. So the home birth rate, cesarean section, for women planning a home birth, obviously they've transferred into the hospital for the surgery, the cesarean section rate for that population is 8%. So there is data from CIHI that shows that the cost of a cesarean section in hospital compared to a vaginal birth in hospital, just by reducing the rate of cesarean section to the World Health Organization's recommended rate of 15%, we would save $50 million a year in this country. In this province. Province, yes.
So sort of, that's what I was looking for, was like a number of people could grab one, or the price of a home midwife-assisted birth versus a hospital birth. I see you say that the Ontario Hospital Association endorses this. Where's the Ontario Medical Association stand on it? Where do the doctors stand?
Well, as far as we know, they don't have a position on this. Certainly, there are doctors who have been interested in this. There was a multi-professional birth center committee convened by Health Minister Smitherman, where I worked together with midwives, doctors, hospital administrators, family doctors, obstetricians, to try and look at some of the issues around birth centers, and a report was submitted to the minister about the feasibility of birth centers in Ontario. So that literature review and assessment of safety, et cetera, has already been done. We believe that there would be multi-professional support for such a thing. And additionally, it provides a really ideal opportunity for interprofessional learning. So at this time we're calling for midwife-led birth centers, but we believe learners from different professions could come into that environment and learn a lot about normal birth, physiologic birth, reduced interventions in that out-of-hospital environment.
Have the parties given you any indication where they stand on this yet?
They may want to speak to that themselves. I don't know, Joanna, do you have a?
More speakers at lunch?
Yeah, I mean, they have, but perhaps you should ask them.
Where should we start? In Toronto, in big cities, I guess, if you have the fundings for those birth centers?
Well, that's also a very good question. I think there are multiple communities in the province that would benefit. Some communities where there is a high service need, where there's communities in the province where already 30 or 40% of the women are in midwifery care, and we know clearly they want this option. Communities like Thunder Bay, Sudbury, there are northern communities where this would be an excellent option. Certainly there's very high demand in Toronto. Women in Toronto have been organizing to try to get a birth centre for decades and definitely really, really want access to that. We know in southwestern Ontario, women in the Kitchener-Waterloo region certainly have been requesting a birth centre in their community for a long, long time. I think many small communities, I'm sure Ottawa, Kingston, there are a lot of places in the province where a birth centre is feasible and could contribute to taking some of the pressure off the hospital labour floors. So we'd like to see multiple sites where this type of a program could be launched.
Do you anticipate the sites being attached to hospitals, sort of a no, not
No.
even?
No. So all midwives in the province have admitting privileges at a hospital. So if there were a reason to transport into hospital, the midwives would go from the birthing center to the hospital where they have admitting privileges, which would be, relatively close by.
And when was that, you said it was committed to by a previous Ontario government? Are you talking back in the early 90s?
Yeah.
It was canceled back then.
Yeah. And our current government has expressed some interest in birth centres. As I said, Minister Smitherman commissioned a report, multi-professional report as well. So they've had some interest as well in getting it off the ground.
If you were trying to persuade voters, not necessarily moms or would-be moms, why this really matters, what would be your pitch to them about why this is really important?
Well, we believe birth centres offer a valuable environment for giving birth. We believe it's safe. We believe it reduces intervention and reduces cost.
How many midwives do we have in Ontario right now?
Just over 500. So we have about the same number of midwives as we do obstetricians in the province. And there's 400 midwives in the education program. So midwifery is a very rapidly growing profession.
Just to add to the issue of less intervention, just on my personal story, I was a low risk birth going into it. There ended up being she ended up taking a long time, over 18 hours, and the doctor did actually try to convince my midwife for a C-section, and my midwife but verbally advocated for me that I was very, very particular that I wanted a vaginal labor. And I did it in the end with no epidural, vaginally. I was absolutely elated. And I feel in some ways that was part of why as I was on my own, I'm a single mother. I didn't have any, when you have a C-section, you're physically unable to care for the baby in the same way that you are if you've had a completely vaginal labor after the birth. So emotionally, I think there are, if you don't need to have a C-section, it's I think a good thing to avoid in my experience and talking to my friends and colleagues.
Thank you.
Thank you.